Hello, everyone. A very warm welcome to everyone joining us for the special World Diabetes Day edition of Diabetes 360, Shaping the Future of Diabetes Care, an initiative by Voice of Healthcare. I am Mayank Badhwar, Senior Editor at Voice of Healthcare, and your host for today's conversation. Every year, World Diabetes Day reminds us of the growing health challenge before us, but also with the incredible opportunities we have to drive awareness, prevention, and better care. Today's session is designed to bring clarity, actionable insights, and hope. We are truly honored to have with us a globally respected voice in endocrinology, Dr. Sanjay Kalra, Treasurer, International Society of Endocrinology, Vice President, South Asian Obesity Forum, Senior Endocrinologist at Bharti Hospital, Karnal. Editor in Chief, Asian Journal of Diabetology, Medtalks, Indian Journal of Clinical Practice, and Deputy Editor at Asian Journal of Obesity. Dr. Kalra, thank you for joining us.
Thank you, Mayank, for the invitation.
So, sir, I'll start with my first question. The latest global data shows that over 11% of adults worldwide are living with diabetes, with Indian alone accounting for more than 100 million cases. How do you interpret this sharp rise, and what does it reveal about the state of metabolic health today?
Thanks a lot, Mayank. This is really important, and we should revisit these numbers. Actually, around 10 to 11% of the adult population across the world has diabetes, but even more worryingly, another 20% has got a disease known as pre-diabetes, which means that their numbers are not all that bad. They don't fit the definition of diabetes, but they have more than a 50% chance of becoming diabetic over the next coming years. So, put together, this number, if you look at abnormal glucose values, this becomes something like 25 to 30% across the world. This is important. What it tells us is that we are doing something wrong. Either there is something wrong in our environment, it is becoming more diabetogenic, or it is causing us to increase our glucose levels, or perhaps it is our attitudes, our behaviors, our choices, our daily lifestyle, which is causing this rise. So look at this ABCDE now, Mayank, and let's look at it one by one. Attitudes, behavior, choices, daily lifestyle, daily discipline, and E for environment. Our attitudes are the normal Indian attitude, sab chalta hai, nothing can happen to me. And in English, Mayank, when we see these proverbs, penny wise, pound foolish, or a stitch in time saves nine, we actually struggle to get proper Hindi or Telugu or Tamil alternatives for them. The closest is from Urdu. पैसे बचाओ अशर्फियां लुटाओ. But most Indian languages don't have this proverb, which means that our attitude is that nothing is going to happen to me. I don't need to take responsibility for myself. B is for behavior. Behavior means that we are, in general, a high risk taking kind of a country. So we will take whatever risks. We know the knowledge, we have the information, we know that we should follow a healthy lifestyle, yet we don't do that. C is for choices. We end up choosing the unhealthy things, whether it is with regards to our meals, with regards to lack of exercise, with stress management. So our choices are wrong. And D for discipline usually goes for a toss. So, when you look at Punjabi songs, for example, our Punjabi songs, they celebrate in discipline. So the guy goes out and says, I will break the traffic light. I will break the rules. And that is considered macho. So that's unfortunate. And then the environment is also there, which prevents us from exercising. All our footpaths have been encroached upon. Uh, we get unhealthy food just at you don't even need to make a phone call. You just press a couple of buttons on your phone and you get food delivered to you. All these make us a bit lazy, a bit more prone towards consumption, and the end result is diabetes.
Yes. So, sir, there are, despite several awareness campaigns, as you have told and we have discussed. So, there are many Indians that remain undiagnosed. They are unaware of their diabetic condition. So, what more needs to be done at the primary level to ensure early detection?
We need to spread awareness, first of all. Everyone, all of us, all adults living in India, we must get our glucose checked at least once a year. If we are from a high risk group, then even more frequently. So that is awareness. Secondly, facilities should be available. So at the primary care level, the good thing in India is we have something called DAT, direct access testing, which means you can walk into a lab and get your glucose done. So availability should be there, which is there across the country. In fact, some of our state governments, like Tamil Nadu, for example, they ensure that glucometers are available at every primary healthcare center. We might want to extend this across the country and ensure that every ASHA worker carries a glucometer with her whenever she goes to visit a house or a family. So, awareness and
Okay.
action. Action means actually getting it done. And then it's not just getting the glucose done, you have to interpret it. So, that action as well. You have a glucose of 141 random. What do you do with it? Now, abnormal is 200, but normal is 140. Between 141 and 200 is pre-diabetes. So we can't ignore that. We shouldn't shrug it away. We should actually take that as an opportunity to prevent diabetes. So these are some of the things. Availability across the country, which is fairly good. Accessibility and affordability is very, very good in India. You can actually get a good quality glucose done for less than 20 rupees. And then I think awareness and that willingness, that action towards interpretation and then further action.
Okay. So, sir, how can individuals at risk, those with family history, obesity, or sedentary lifestyle, take proactive steps to delay or prevent the onset of diabetes?
Yeah. So we have different types of diabetes, but here we are talking about type 2 diabetes, which is the commonest form. 95% of all our fellow citizens with diabetes have type 2 diabetes. So basically, the risk factors, and you've already mentioned them. If you are stout, that means a bit overweight or obese, then try to lose weight. If you are sedentary or lazy, then you begin exercising. Every movement counts. If you are fond of starch and sweets, that's calories, then reduce them. So every morsel, every meal counts, every movement counts, and try to reduce them. There are other S's as well, and one S would be stress management. If you are under stress, that creates counter regulatory hormones in the body, which increase glucose levels. So we need to calm ourselves down. And there are a million ways of stress management. None of them work, but any point of none of them work with everybody. But at any point of time, one method will certainly work with you. So
Okay.
let's go through this list of S's. If you're stout, you reduce weight. If you are sedentary or you're fond of starch and sweets, you try to discipline yourself. If you have stress, handle that. If you are into substance abuse, please reduce that as well.
Okay.
Couple of more S's. One is what the surgeon or the physician has told you. It is possible that you might be taking some medicine, whether from modern medicine or from alternative medicine, which is causing an increase in glucose levels. So ask your doctor. If your doctor is going giving you any kind of a tablet or any kind of a powder or a syrup without a label, please do not trust that. If your doctor is confident, everything will be written in black and white. And your doctor will inform you, yes, I am giving you a steroid, but this is life saving for you. Let's handle your glucose as well. That message will come confidently from the doctor.
Okay.
Two more essays, which are more of solution oriented essays. One is spirituality, and the other one is social connectedness. So, spirituality means that it's not the same as being religious. Spirituality is a way of calming yourself down, it is a way of stress management. And social connectedness means connecting with each other. And here, Mayank, I would like to thank you and the voice of healthcare for connecting us together, because this is one way of relaxing, calming ourselves down, and also learning more information about diabetes so that we can help ourselves and help others as well.
Yes, sir. So, sir, as you have mentioned that calories matters. So, diet continues to play a crucial role in diabetes prevention. What would you recommend as the most suitable dietary approach for the Indian population? As we all eat parathas in the mornings with a lot of butter and all that. So, what is the dietary approach to avoid diabetes for Indian population, especially?
So, just a few rules. In general, stick to the Indian thali with a few tweaks here and there. There's no need to go for a Mediterranean diet or to go and get expensive imported olive oil. So, whatever we are eating, we have to increase the protein and increase the fiber. We have to reduce the carbohydrates, especially the simple carbohydrates, and in some cases, reduce the fat. Recently, we published data from the iStarch 2025 study, which shows that we Indians, we tend to eat more of carbohydrates, more of simple sugars. Our
Yes.
fat percentage is fairly okay, but the proteins are deficient. So if we want to prevent diabetes, if you're obese, first of all, try to reduce weight. Reduce the calories by 500 calories per day. We need a 500 calorie deficit. Secondly, try to take a 3 plus 3 meal pattern, which means small, frequent meals interspersed throughout the day. If you try to remain hungry for 12, 14, 16 hours, by the end of that period, you will be so hungry you will end up overeating. So, a little bit of eating every 3 to 6 months is fine. 3 to 6 hours is fine. What should
Okay.
we eat? Like Mayank said, avoid the paranthas and the ghee. But then, if you avoid that, what do you take? So, instead of a gobi ka parantha or a mooli ka parantha, you can take a gobi ki roti or a mooli ki roti. See how to cook that. When you're kneading the dough, put some milk or some yogurt in it, some curd in it, that makes it much softer. You will not need butter or cream afterwards. Instead of making separate layers of the stuffing, you just add that minced cauliflower or the grated radish into the dough and you cook it on a dry tawa, on a dry griddle pan. This becomes a mooli ki roti or a gajar ki roti or a gobi ki roti or a paneer ki roti. Because there is already a little bit of milk and curd in it, it becomes so soft you do not need any accompaniment. So that's the way to go about it. So first of all, these are some changes. We need to increase protein as well, Mayank. Most of us are deficient in protein. If you eat eggs, that's fine. Otherwise, you increase soya bean, increase dals, and the dal with the maximum protein content in India. At number two, we have white soya bean, which we call soya bean. At number one, we have black soya bean. The Hindi for this is bhatki dal. This comes from Uttarakhand, and this has the highest protein content.
Okay. Oh, so sir, like you have mentioned that many patients struggle with adherence to diet and
Yeah.
medication and follow-ups. So how can a healthcare provider better support behavior change of the patient?
This is really important, Mayank. So, whether we are fighting diabetes or obesity or any other lifestyle disease, our lifestyle depends upon our behavior. So, we use that ABC attitudes, behavior, choices. It is behavior which is key. So, some things, Mayank, from our Indic philosophy, from our traditional philosophy, like from the Bhagavad Gita, it is said that if your thoughts, your words, and your actions are concordant with each other, then you are in harmony. So we need to focus on our thoughts. But thoughts are a very slippery eel to catch, Mayank. एक बहुत ही फिसलाऊ बाम मछली है, बहुत मुश्किल होता है अपनी थॉट्स को पकड़ना. And then the younger you are, the more chanchal you will be, the naughtier you will be. Oh yes, see that smile from Mayank. Yes. So now you know who is naughty here.
Yeah.
And an easier way would be to catch hold of your words. So that is easier. The term used for this is neuro linguistic programming. So if I were to focus on my words, I were to use happy words, optimistic words, action oriented, solution oriented words. So, for example, I can do it. I can prevent diabetes. I just have to reduce my caloric intake by half a chapati, by half a katori, by half a glass. Once I do that, next week I'll reduce by another half katori, half glass, half chapati. So that's the way to begin saying, to begin verbalizing. Once you do that, automatically your thoughts and actions will follow suit. So behavioral therapy begins with the bully. That means with what we are speaking. Alone no one can do it. All of us need buddies, we need friends. So Mayank and I are buddies, for example.
Yes.
So when you are with each other, when you are with the healthcare professional, keep on boosting each other up. So
Okay.
if we were to all become barrow buddies, gluco buddies, all means the entire community, the entire society, the entire nation, automatically we would move towards better health. So this is the way at a mega level to improve behavior. At a micro level, we do need hand holding, all of us. So the best hand holder will be a person who is qualified, a qualified endocrinologist, a qualified physician, a qualified dietitian, whoever you need. They are there as a team to help you out, and they help you by nudging you, by pushing you slowly, one nudge at a time, one meal, one movement at a time.
Yes. The support from family, friends, that is all at the starting we need. Yes.
Even more important, because when you are with the doctor or the dietitian, that is just 5 or 10 minutes, but your entire day is spent with family and friends. If they are on the same page as you will be successful. If however
Yes.
your family and friends keep on interfering with everything, and they keep on trying to sort of negate the advice that has come from the doctor, then we'll reach nowhere. So we do need those buddies as well, those family buddies.
Yes. So, sir, I'll move on to our next segment, which is the rapid fire round. I'll ask short questions and would request you to give short answers for them.
Sure.
So, sir, one biggest myth about diabetes you like to burst.
That diabetes is caused only by eating excess sugar and by nothing else.
Okay. The healthiest Indian breakfast for diabetes.
If you're non-vegetarian, then eggs along with a chapati. If you're vegetarian, then perhaps paneer and dal along with the chapati. You can change the style of cooking the chapati so that you don't get bored.
Okay. So, one lifestyle habit everyone should adopt today to prevent diabetes.
10 minutes extra of exercise, 10% less of ghee and cooking oil in your diet.
Okay. Sir, biggest misconception patients have about insulin.
They feel that this is a sign of failure and it will cause ill health. While actually, insulin is physiological, it's normal, it's healthy, it prevents ill health, it maintains good health.
Okay. Your go-to-go advice for someone newly diagnosed with diabetes.
Change your lifestyle, begin exercising, follow the right diet. You've just been diagnosed. If we work hard, we can get you into remission.
Okay. So, sir, Dr. Kalra, as we mark World Diabetes Day, what message would you like to share with individuals and families across India on taking charge of their health and preventing diabetes?
Well being. This year's theme is diabetes at the workplace, diabetes and well being. So, wherever we are, whether we are at home, whether we are traveling or at the workplace, a lot of things are in our control, lots and lots of things. So, well being is the most important. Remain happy, ensure well being around you, in the people around you. That will improve your own well being as well. And you will be able to come out of this spiral of poor health with diabetes. So, take charge, take control.
Thank you so much, Dr. Kalra, for sharing such timely insights and practical guidance. Your expertise brings not just awareness but true empowerment. Thank you, Dr. Kalra, for joining us.
Thank you so much. Thank you for the opportunity, and wishing everybody great health, great happiness ahead. Jai Hind.
Jai Hind, sir. Thank you, sir.